alam ko kasi sa PPD, sa unang buwan lang yun nangyayari. Tapos sa mga susunod na buwan, mawawala rin lang.
Babae lang naman yung nagkakaganyan kasi malakas yung toyo nila. Sus, lilipas din naman yan.
Normal lang yan, lilipas din yan.
Naalala ko, may kakilala ako na nagkaganyan. Iyak siya. Iyak siya ng iyak. Hindi pa siya masaya na meron na siyang anak. Ganon, di ba?
Ang alam ko kapag may postpartum depression, yun bang sasaktan nila yung sarili nilang anak. Yung iba nga yata halos napapatay na nila yung sarili nilang anak. Yun daw yung kadahilanan na may iba na raw kasi yung nakikita nila.
The birth of a baby can trigger a jumble of powerful emotions, from excitement and joy to fear and anxiety. But it can also result in something you might not expect. Depression. Postpartum depression, or PPD, is a complex mix of physical, emotional, and behavioral changes that happens in some women after giving birth. According to the DSM-5, a manual used to diagnose mental disorders, PPD is a form of major depression that begins within 4 weeks after delivery. The postpartum period begins immediately after childbirth, as the mother's body, including hormone levels and uterus size, returns to a non-pregnant state. The terms puerperal period, or immediate postpartum period, are commonly used to refer to the first 6 weeks following childbirth. It is therefore important to note what is not postpartum depression. Most new moms experience postpartum baby blues after childbirth, which commonly include mood swings, crying spells, anxiety, and difficulty sleeping. Baby blues typically begin within the first 2 or 3 days after delivery and may last for up to 2 weeks. But some new moms experience a more severe, long-lasting form of depression, known as postpartum depression. Rarely, an extreme mood disorder called postpartum psychosis may also develop after childbirth. States of depression, often called new parent blues, are almost universal among new parents. These depressive states tend to be more pronounced in fathers and in parents of first babies than in those who have already had 1 or more children. In new mothers, depressive states are partly physical and partly psychological. The glandular changes accompanying pregnancy and childbirth, fatigue from labor and childbirth, and the generally weakened condition that persists even after normal childbirth all contribute to maternal states of depression. Also, there is concern about the care of a helpless infant, the added expenses, and the changes in the patterns of life. To these conditions may be added the letdown of a new mother experiencing going home after being cared for in the hospital and being the center of attention of family and friends, to assume the full care of the infant, and in addition to look after the home and children as well. While new fathers do not have the glandular changes that contributes to depressive states in mothers, they often experience a letdown after worry and strain about the welfare of their wives, especially during the last stages of pregnancy and childbirth. The more difficulty the pregnancy and the childbirth, the more concerned men feel, and the more letdown they experience when the baby is born and all is well. For most fathers, new parent blues are more psychological than physiological. They are often more concerned about the extra expenses they must meet, especially if the mother has to give up her job. Many men are also concerned about how the pattern of their lives will change as a result of parenthood and what this effect will have on their marital relationship. New parent blues can and often do play havoc with the infant's adjustment to postnatal life. The new baby senses the tensions of the parents, especially of the mother, and this makes it more nervous and prone to crying. Many infants cry more when they get home than they did in the hospital. Without question, one of the causes is new parent blues. Postpartum depression isn't a character flaw or a weakness. Sometimes it is simply a complication of giving birth.
Kailangan ang medical intervention. The best doctor to see sa ganitong klase, aside from the obstetrician, is a psychologist and psychiatrist para sila yung deliberate kung ano ang dapat gawin sa mother na ano. So yung iba gumagaling sila after so many months, but you cannot always rely na pwede silang gumaling at their own. Pwedeng pag nakita nila yung anak nila, babalik ulit yung depression nila, o pag nagkaroon sila ng negative mga occurrences sa bahay, babalik ulit yun. So you have to treat. Kasi forever and treatment yan, mga sa vitamins nila, vitamin E, vitamin B, depende sa titingin na mga neurologist and psychiatrist. And it is a constant, siguro pwedeng every 3 months, pag-check up sa psychiatrist ulit. It's just a continuous follow-up para hindi lumala yung mother. Kasi importante din na healthy yung mother.
PPD can occur at any point during the first year after a baby is born.
Ang pagkakaroon ng postpartum depression ay hindi kahulugan ng pagiging masamang magulang.
Hindi lang pala mga babaeng nakakaranas nito. Pati rin kami mga lalaki.
Postpartum depression will not go away on its own. You need help from friends, family, doctors, and mental health professionals to help you overcome the symptoms.
Not all women with PPD can cry all the time.
Women with postpartum depression do not harm their babies. Postpartum psychosis is a very rare disorder, and it is different from postpartum depression.